Hey everybody, Steve the Hurricane here, and I have to tell you, I am really excited for this webinar today, finishing strong, because there's so many great things that are happening right now, and I'm having a wonderful week so far, and I hope that you are too. And before I get into the full webinar and I share my computer screen, and I know people are jumping on, but those of you who have been on other webinars with me before in the past, you know I like to start right on time, because all of you showed up early or on time. It's important that I respect your time just as you're respecting my time as well. So I'm going to jump into it. But as we're getting started here, one thing I do want to say is, and I said this to one of my clients this morning, I started my day very early. I have a routine where I'm up by 6 o'clock in the morning. I have a fitness routine that I do. I eat certain foods. I also spend a lot of time in prayer and meditation. I'm a minister, Lutheran denomination. I'm a minister. You know, Jesus is my Lord and Savior, as you all know, or maybe you don't know, and now you do. But between my first appointment at 9 o'clock this morning and my second appointment at 10:30, I had said a prayer, and the prayer that I said really put things into perspective on appreciation. And I know that every single one of you on this webinar right now, we're all tired. We're all stressed out. We're all burnt out. You know, when I think about the last 18, 19 months of this pandemic that never seems to fully end, right? And I'm not going to get in anything political or anything. I'm just stating the facts, right? The industry that is so tired, so exhausted, so burnt out is our industry, healthcare. You know, I've already started traveling again. I started traveling to my clients' offices, and every time I go into one of my clients' offices, after I leave, the owner of the business says to me, Steve, thank you so much. We needed this. We're burnt out. We're tired. And so as we're kicking this off here, my biggest message for you as to how to finish 21 strong, before I get into anything else, I want you to appreciate what you do have going for you, right? I want you to appreciate it, because I was thinking about it. And, you know, my first call of the day was with one of my clients who's been with me for a while, who wants to exit and sell his business. And so we were talking about his exit strategy and his exit plan. And that is a good conversation to have. He's got a very successful business, and what is it going to look like and everything else. And I'm like, man, how lucky is this man who's going to be able to exit and sell his business and then go do something else, because he wants to move on into something else, right? So, and he's going to be able to exit it for a 7-figure payout, right? You know, multiple millions of dollars, and that's a beautiful thing, right? And he should be grateful. You know, as we were talking, we're talking about how, you know, every year a certain number of people get into starting businesses, and in the last 18 months, people who would have opened up a restaurant didn't. People who would have opened up a gym or something didn't. And everyone's looking what business to get into, what's a pandemic-proof business, and home care is right at the top of the list. You know, I'm talking to a lot of different franchises who are reaching out to do work with me and pick up now that the pandemic is at the tail end of it. And every one of them is talking to me about how they're adding more franchisees this year and how they're doing this and they're doing that, and it's exceeding their expectations from what they had in January. And so while we are tired, while we are burnt out with everything that's going on and the constant regulations and the caregiver challenges and everything, and I'm going to address all of this in the webinar, what I want you to do, if you're the business owner, is appreciate that, hey, I got a business. I got through this, the worst part of this pandemic. You know, if you're an employee, hey, I got through this pandemic. I have a job. I'm productive. I'm part of an organization. My organization is growing. You know, I still think about the businesses that closed down that haven't reopened yet. You know, I think about the restaurant industry and how crazy it is for those folks, or how crazy it is for the gyms and stuff, and what they're dealing with, these circumstances unlike any other. I'm a New York Giants season ticket holder, and God, they're so bad, right? And I went to the game on Sunday, And there was 72,000 out of 80,000 possible people that showed up and cheering and stuff. And some people were wearing masks. I brought one with me for when, you're walking in the gate, and my son was with me and he's young. And so he had one on. But once we got to our seats, we stopped, and, things are starting to come back. And so with that in mind, I want us all to move forward, to progress to finishing 2021 strong. That is why we're here. That's what this is all about. And so I'm going to share my computer screen and you all can see it right here. This is the message that I'm sharing with you because I know we are going to make sure that this year finishes strong. The home care part of the healthcare industry, we shined our brightest these last 18 months. And I know that the future is so bright, it's so strong for all of us that if we wrap our head around the things that I'm going to go over today, and this is different from some of the other ones that I've done in years past. There's a couple of things that are similar, but we're going to talk about how do I plan for the fourth quarter. Amazing historic records don't just happen. They are planned, and then you follow and execute the plan, and then all of a sudden you get the business and the revenue that you're looking for, and then you finish the year, you got your holiday parties, and then you move confidently, boldly into 2022. Now, again, something that I am going to just remind you all as you're here, whenever I do a live webinar, when you join me live, I always want to give something away and thank you for coming and sharing this hour with me and spending the time with me. And yes, I'm going to give you the motivation, I'm going to deliver, I'm going to do all these great things, but I want to also thank you. And so at the very end, I have a number written down right here on my desk in front of me. I'm going to give to one lucky person live at the very end of the webinar who stays with us a free gift valued at $1,000 just for being on this webinar right now as my thank you to you. And so as I'm going through this, I have a huge announcement to make, and the huge announcement, it's the Hurricane Marketing Bootcamp, but it's not just any Hurricane Marketing Bootcamp. It is the Hurricane Marketing Bootcamp, the specific one, which is the Millionaires Bootcamp. And something that I'm going to tell you all publicly right now so that you are all aware of it, this will be the last boot camp that I ever do going forward. So everything, we've made a lot of changes these last 9 years in business, and there are some big changes on the horizon that I'm working on, but this will officially be the last Hurricane Marketing Enterprises Home Care Millionaires Bootcamp. This will never be done again in person. I have not really advertised too much. I've been advertising on advertising, and you've been seeing some emails, but you haven't seen a lot of information about it on Facebook and stuff because it's almost sold out. We only have 14 tickets left and there are no other spots available. So if you want to come to that boot camp, and again, this is my last boot camp. If you've never been to one, you better get one of those last 14 spots. All right. I'm toying with some other things, but you make sure that you get to this boot camp. If you have a ticket, register, confirm. If you don't and you need to get one, you can contact these numbers there. You see all these companies here, by the way, just to give you an idea, the reason why there's only so many tickets left, because all these companies are going to be there. Digital Champions, AidQuest, which is working with helping people to get and recruit and retain caregivers. Straight North is a website development company. We have Smart Care and Ancoda. Those are two of our power partners that we work with on software for folks. And then the Solutions Group, this guy, David Dickey, he's the representative from the Solutions Group. He goes so far back from coming to all these boot camps with us over the years, and I just love the man because he does so many things so differently from everybody else as a sponsor. But when all these companies are coming together to represent here and meet you and your organizations, this is going to be a legitimate huge event. And like I said, it's almost sold out. There's only 14 tickets left, so get them while they're hot, I guess. You can get a reserve list if they're sold out when you call in, but make sure you let us know and you get that spot because this is my final boot camp. All right. So I want you all to know that. So this is us right now, stressed out, burnt out, but I've already addressed that. So let's just get into the meat and potatoes, Steve. All right. So here's what I'm going to go over with you. First things first, we're going to talk about fourth quarter planning. I think it's very important that we talk about fourth quarter planning, because when you understand, how do you set up for this quarter to make it be what it needs to be so that I can move forward with confidence. And again, you heard me say, record-setting quarters don't just happen. You don't just fall into record-setting quarters, right? You have to plan for it. And then what makes everything else that's 2 through 6 on here just falls into place because of the first part of it where you planned to make this happen. Then we're going to touch base on X factor marketing and things to do differently to help your company stand out from the competition, because at the end of the day, we got to make sure that we're getting the right type of referrals. I know we're going to talk about caregivers as well, covering shifts and how to get more caregivers. But one of the biggest things that I teach people through our programs like the Hurricane University and such is how to set up your business operationally so that it makes it easier for you to attract and retain caregivers based on the minimums that you have, the shifts that you're setting up, and everything else. So we're going to touch on that as part of your planning that goes into it. There are some big holidays that are coming up. You have Halloween next month. Like, it's crazy. Today is September 15th. The month is half over, right? So Halloween is next month. Thanksgiving, Christmas, Hanukkah, Kwanzaa, Ramadan, all, you name it. And then the New Year, right? There's so many holidays that are coming up. We have to have a plan for it, and then we have to be able to execute for it when the time comes. And then obviously referrals and getting paid and all that. I want to make sure that your accounts receivables are where they should be, that you have the revenue coming in, that your profit margins are where they should be, because I'm going to talk a little bit about your exit plan as well. Again, a lot of you I know are burnt out. I'm very owner focused. When I first got into this business, I started focusing on home care sales and marketing. Over the last 9 years in business now, it's gotten to a point where I spend just as much time talking about operations and recruitment and retention on how to scale your business, because that's really what I teach people how to do, as much as I do with marketing and sales. So marketing and sales is only a part of it. We got to make sure that we have a profitable business so that when the day comes and I decide, you know what, I don't want to do this anymore, or maybe, you know what, I have 2 or 3 grandkids and I want to spend time with my grandkids. And I know that there are folks listening right now. There's over 100 people here with me. I know that there are folks right now listening who are like, man, that's exactly, yep, how did you know I have a grandkid that I want to spend more time with? Because that's what my clients are telling me, and that's what I'm helping them do. As we're talking about this fourth quarter planning and stuff, I actually had a compliment that a lady said to me the other day, and it wasn't necessarily meant to be a compliment, but I took it as a compliment. And she actually was coming from a place of concern. She said, Steve, you post all this stuff on social media. You went on vacation for an entire month last month. You're out on your boat every other day. You work out and you're in good shape, and you do this stuff with your family, whatever. And I'm afraid that you got to stop posting that stuff because you're not relatable. People can't relate to you anymore. And I said, first off, thank you so much for your concern. And I appreciate it, because she was trying to, give me some tips or advice. But I have to tell you, on the flip side, the people who come to me for advice and guidance are the ones who see what I do with my personal life. And they're like, you are doing things that I want to do with my personal life, and I'm not doing it. So clearly you figured something out that I haven't figured out. How can you help me do that? And that's what I do. So I love doing that. And my clients, as a matter of fact, tomorrow I'm having a board meeting for my members of the Home Care Elite Academy. They're coming here to my office, and we're going to be going over in great detail for the next 3 days how to set up all of this stuff for their businesses, so that they not only will be able to have the plan and go back and execute it, but they're not going to be ripping their hair out trying to make it happen along the way. And that's a big part of what I do. And I share this with you again because I want you to know, if you do these things, you're going to have a great quality of life. And it's not just about money, but it's about the business, right? How your business runs. And then you can focus on the parts of your business that you love the most. Do that. I love doing these webinars. I love doing my classes. I love training my clients. I love visiting my clients' offices. That's what I love. That's all that I do in my company. And I have other people in my company that do everything else. How did I set it up? Because I planned for it many, many years ago by doing these planning sessions that I'm talking about with you right now. So what does a fourth quarter planning session look like? All right. And you see, again, these are the sponsors that are going to be at the boot camp. Part of your planning session, when you plan your work and then you work your plan, the number one thing I tell people when they do the fourth quarter planning session is to get out of your office. Take a key person or several key personnel in your organization with you and get out of the office and have a planning session for the quarter. All right. So in my company, Hurricane Marketing Enterprises, is everything I'm teaching you. I did this back at Care Choice, my private duty home care company that I had back in the day, for those of you that don't know. And I do all this now with my company, Hurricane Marketing Enterprises. Nicole Peretti, who some of you know, is my executive director. So as my executive director, she and I, we go off-site, get out of the office. Why is it important that we get out of the office? Because in the office, this is the war zone. This is where there's phone calls. This is where there's challenges. This is where there's adversity. This is where we're in the middle of a meeting and something happens and someone has to come in and tell you something, and then there's fires that have to be put out. And I know it's the same thing across the board in any business, you know, home care especially. You got call outs, no shows, caregiver this, client complaining about that, you know, all the different things you got to deal with. If you can take your executive director, your office manager, your top scheduler, that key personnel with you and the owner, marketing representative, and get out of the office, go to a restaurant, go to a library. If it's nice, go outside to a park. I mean, Nicole and I've done some crazy go off-site days over the years. I went to a vineyard that I'm a member at nearby, and we had a room, and you know, we started out talking a lot of business, then we had a couple of drinks, and then we just started laughing and having fun. But you know, get off the office, because when you're not in the office, then you can focus working on your business instead of in your business. All right. And then what you want to do at this meeting is take a look at all of your KPIs. Go over your goal that you set at the beginning of the year for 2021 and see where you are. Know your starting point through 9 months of the year, or through 8 months through August 31st, and then see what you have to do September, October, November, December, and really it's October, November, December, fourth quarter, to be able to still hit that goal. If you are trending beyond that goal, adjust your fourth quarter goal to make it even greater than what you originally planned. If you're trending below, that's fine, but adjust the fourth quarter so that you're still shooting for something that's not just going to happen through osmosis, because you want to work towards something, and then that can help you get out of a current rut that you're in. Now, as part of this planning, one of the other things you want to do is start doing reviews and evaluations. All right, reviews and evaluations. What do I mean by reviews and evaluations? One of the things that Nicole and I do at every one of our meetings is we go through a rundown of all of our staff, and we start talking about strengths and weaknesses of our staff, who's good for this, who's good for that, who's challenged with this, who's challenged with that. Maybe there might be some personal things that come up during these discussions. If somebody's got some personal issues that are going on in their life or things that are happening, we talk about advancement opportunities, or we take a look at the workflow, how much time it takes for the work to get done, and we start to decide. And we also are looking at profits and losses as well, and we're deciding, do we need to bring in another person to help us with it, and what is that going to look like? And as a result of doing these fourth quarter planning sessions in September right now, this has allowed us to grow the organization every year, with the exception of 2018, and there was a big issue that had come up that I had to deal with, some legal things that I had to deal with in 2018, but every other fourth quarter that I have had in the 9 years in business exceeded and broke and set a new record from what it was prior to. Every single fourth quarter. Why do we finish so strong? It's because we planned for it. And then when we come back after this meeting, over the next 2 weeks, the last 2 weeks of September, is when we sit down with every single person on our staff and we talk about a review, a raise, performance improvement plan if the person isn't doing what they're supposed to do correctly, a possible change in position, a repurposing somebody. Jennifer, I'm seeing this, right? You're having a very hard time grasping this. I need this done. I'm taking this away from you, and I'm going to give this to D. On the flip side, I've identified that D, who's one of my office, these are real people in my office, and these are conversations that I've done over the years with my staff to develop them as people, so that I know that they are doing what I need them to do, so that I don't have to do it myself, right? This is just being a smart entrepreneur. I know that D has challenges with X, Y, and Z, and I think that you're better suited for that, Jennifer, so I'm taking that from her and giving it to you. And then we do the swap vice versa, going back and forth. We had somebody in our organization who had to part ways with us, and she recently parted ways, and it wasn't a bad thing. She went to school for a certain purpose, was working for us, and just to make money because she couldn't get a job in that field. And then she got a job offer 3 months ago in that field. And so how can I blame this young 20-something-year-old woman who worked for me from leaving my company to go do what she went to school for? Of course, God bless you, good luck. So I came back to my staff and I said, staff, if we can divide up, and I did exactly this, I sat down with every single person and I divided up the responsibilities from on that person. I said, if you can prove to me that you can do this, I'm going to take a significant portion of her salary and divide it up equally amongst every one of you. I gave them all a raise last week. Do you think everybody's happy with that raise? Absolutely. Does it hurt my company at all? Nothing changed financially for my company, except for I gave a little bit more to my staff because they earned it and I didn't have to replace another person coming into the business. That's working smarter, not harder. That's developing your staff. And by having these meetings on a regular, consistent basis to plan your next quarter, that's how you get these record-setting, 500,000 billable hour, incremental jumps quarter after quarter after quarter after quarter. All right. I also want you to do a self audit, and this is where you see all these different companies to choose from, right? This is a time when you take a look at, what software am I using? Do I like the software that I'm using? Is it performing the way that it's supposed to? Are we getting the maximum return on investment, or is it glitchy? Are there lots of mistakes? People are avoiding using it. We're spending more time trying to figure out how to use the software than the software itself is actually working for us, and you're having a lot of challenges. If that's the case, then it's time to consider making a change, because I will tell you, changing software takes a solid 3 to 4 months to really get it so that you're proficient. If this is something you want to do, this is part of finishing 2021 strong, so that you go into the new year fresh, clean slate, ready to grow, right? So I would highly recommend talking to SmartCare and talking to Encoda, getting a demo from both of them, and then choosing which one you feel is right and best for you. As part of your self-audit, you may want to take a look at your website and see, you know what, I haven't updated my website in like 4 or 5 years or 10 years, like many people have. This is where I recommend contacting Straight North and seeing what they can do. And yes, these are people who are sponsoring the boot camp. Yes, they gave me money for it, all right? But I can tell you, especially with these two here, I have done a lot of work with them. My clients like these companies. So part of the reason why they're sponsors is because I have a relationship, and I said, hey, you should come to my boot camp and meet my clients, because you offer a service that they could do well with. So I highly recommend, if you're looking for a website, you can reach out to Straight North as well. I will also say, as part of your self-audit, take a look at what you're paying for liability insurance. Take a look at what you're paying for workers' compensation and other type of insurances out there. If you are happy with your provider and you've had a couple of claims that had to be filled and they did so in a timely fashion, stay with who you have. But if you're not happy and you're looking for somebody else, this is the time of year to evaluate all of those things, and then if you decide to make a change going forward, you can do so, and you plan it out. This is all stuff that has to be discussed during that planning session, all right? And then when you come back, I'm talking about inquiry training and custom pricing, but I'm going to get to that in a little bit, because a big challenge that we're having with getting caregivers is pay. right? And so caregivers want more money. So I'm going to talk about inquiry training and customizing your pricing and stuff to adjust things going forward on more of a case-by-case basis in a couple of minutes as we go through this slide. So this is how to plan for your fourth quarter. This is what you want to do and the things that you want to take a look at and how you want to proceed forward after you have this planning session to get ready for the quarter. So this is the next 2 weeks of the month. We haven't entered the fourth quarter yet. All right. Now that it's the fourth quarter, this is where you want to start X factor marketing type stuff, things that make your company stand out from other companies. All right. You hear me say risk being the fool. Risk being the fool is basically a term that means that you're doing something that's a little bit different, that some people may think that, that's a little foolish, that's a little silly, but the majority of people love it and you get a great return on your investment. Something like Halloween costume marketing. Not every person is for it, and I get it and I understand it. But I will tell you, over all the years of my career when I used to go marketing, and all of my clients around the country who go marketing on Halloween dressed in costume, every referral source they go to, all of the staff are dressed in costume. And when you show up in costume, they let you in and you interact and mingle and market with them. Again, fourth quarters don't just happen. Historic record revenue and our growth quarters don't just happen. They're planned. When you get that spurt, you plan for it. So plan for your Halloween marketing. Plan to be doing harvest festivals and Oktoberfest type events. Plan for all of this now. Set a budget for it now. Get your power partners together with you now and plan these events for the second half of October all the way through the end of the year. So instead of you having to try and throw it together last minute, you just show up, execute the plan and go forward with it. And also, again, to this point of having fun and getting remembered, when you do things, remember I said at the very beginning here, the healthcare industry is burnt out. When you do these different type events and fun activities and stuff and tying it into the holidays, your referral partners remember that. And then when it comes time for a referral to be made, who are they going to refer? The company that's always asking them for a referral, or the company that came and interacted with them and had fun with them and they know is going to get the job done? That's you and your company. That's X Factor marketing. All of this takes place these next 3 months that wrap up 2021. And just throwing a plug here for my buddy Nick, who used to work for me, who's from Digital Champions. He's going to be at the boot camp as well. He's going to be our master of ceremonies for the event. My final boot camp, I'm excited to have him do the master of ceremonies, MC, for those who don't know what master of ceremonies is. And Digital Champions, he does a lot of digital marketing, social media marketing to help, again, X Factor, help you stand out from your competitors in those vehicles for generating revenue. I'm also going to talk about holiday marketing and planning with it. You see that first line, go to everything. You don't want to pass on an event that's happening. You want to go to it. If there are multiple things happening, like I was talking to one of my clients this morning down in Texas, the next 2 weeks, and forget the holidays for her. Next 2 weeks, there's like 5 or 6 different things that are going on in her marketplace. So she, the owner, who has 2 marketing reps, by the way, the owner is going to go to one event, and each marketing rep is going to go to another event in their respective territory. So literally 3 events simultaneously, divide and conquer. Business owners right now who have marketing reps, that is what you should be doing. Never pass on an opportunity to go to something, especially right now as we're at this weird juncture right now with COVID-19, right? And I say weird juncture because some places are operating the way it was before COVID was a thing. Some are operating as if it's, April 5th, 2020, and it's complete tight lockdown. And then you have but those are the 2 extremes, and you have everybody somewhere in the middle in between. So you can't pass on opportunities. Go to everything. But remember, when you go to everything, your goal is is not just to go there to show up. Your goal is to go there and then schedule or do what I call book a meeting from a meeting, where you are going to meet somebody, talk to them for 5 to 10 minutes, and then say, this is a great conversation. I'd love to continue it, but there's other people here at this event. Can I come see you, meet you for a cup of coffee? You come to my office, whatever, you schedule it. You literally pull out the calendar on your cell phone, and you book a meeting from a meeting. And you see me scrolling through my calendar here every single day of my life. From a work perspective, I always have at least 4 or 5 appointments. The reason why is because I always am booking meetings from a meeting. Somebody contacts me, we discuss, I book the follow-up before I end that conversation. You should be doing the same thing too. So when you're going to these meetings, you're always walking away with 2 or 3 meetings for the next couple of weeks per meeting you go to. That's part of why you go to everything. I want you to start scheduling outcomes meetings. All outcomes meetings are, because I'm looking at the time, I'm running out of time and I have other things that I have to get to keep us on time here. An outcomes meeting is where you're working with your existing referral partners and you schedule times to go over the outcomes of the referrals that they sent to you this year. Now, if you have referral sources that have only sent you 1 or 2 clients, you really can't have an outcomes meeting because they're not really referring you. You have to develop that account further. You have to develop that account deeper. As a matter of fact, on one of my calls this morning, I was talking to a marketing rep who's crushing it, right? She's got like 20, 25 accounts in her territory, and every week she's getting 5, 6 referrals. And so I said to her, hey, I'm glad you're getting 5, 6 referrals a week every single week. I'm very proud of you for that. What I'd like to see going forward, though, is less time trying to develop new accounts and more time further deepening the relationship in these 20 accounts that you're already going to that are already referring you, because they need to be referring you closer to their max referral potential. Meaning a certain account, and there's a lot of stuff, I know I'm talking high level, what is max referral potential? Every account has a potential to refer you based on certain parameters that I don't have time to get into. But whatever that maximum number of referrals should be, your goal should be to get at least half of that. If you're not getting half of that maximum referral potential, you have to develop that account further and deeper. I will tell you, marketing representatives and business owners, it is much easier to get more referrals from existing referral sources than it is to develop new referral sources. Remember that. It is much easier to get more referrals from existing referral sources than it is to get referrals from a new account. So don't spread yourself thin trying to get referrals from places that aren't referring you. Spend more time getting deeper in the accounts, have outcomes meetings going over the reports of what people have referred you, and then leverage that to get more business in the new year. These are things that you should be doing in the fourth quarter. We talked about holiday parties, going to everything, so I'll just skip that. Health fairs, go to them. If they're having them again, go to them. I don't care if it's $100. Like something that every person's different, and I know that every one of us on this webinar today, you're all at different stages in your business. And I know that some of us will watch the dollars more than others. I will tell you, I spend money in my business like it's water. My credit card bill. The benefit of having a high credit card payment every single month with good benefits is I haven't paid for any Amazon purchases personally in like 5 years, right? Because every month I get like $500, $800 in credit from my credit cards because I spend so much money in the business, right? So there are perks to spending money, but it takes money to make money. And if there's a vendor fair and it's $150, I'm gonna go to it. You gotta know how to work the vendor fair, and that's where I was saying before about the book a meeting from a meeting. And even if I go to a vendor fair and I don't get any business directly from it, but there's 20 or 30 other vendors, I'm gonna book a meeting with all of the other vendors. So that one vendor fair could give me 10 meetings in the next 2 weeks that follow, and out of those 10 meetings, 2 or 3 out of those 10 could turn into long-term relationships that lead to dozens of referrals. And that was well worth $150 for that vendor fair. So go to it, pay the money, do what you got to do. Vendor fairs, health fairs, that's combining them. And then, do your own events. Something that I told all of my clients last week, is do a blood drive. Right now, blood drives are necessary. The blood banks are low. People aren't giving blood like they used to. Reach out to your blood banks. You know, there's a soap, and I'm looking at my desk. I don't have it here. It's in the other room, but it doesn't matter. Something I talked about people doing last year was to do a blood drive, and I tied it into Halloween, and I used to tell people, call it I want to suck your blood drive, right? And you tie it into Halloween. And you have people show up, you get people to register. A lot of blood banks, you have to have at least 10 people committed before they'll show up. A lot of them have buses. You can talk to your referral sources and you can collaborate on it. And every person who gives blood, I told my clients, get the Bath and Body Works foam soap, and they have different type of Halloween themed soaps, and some of them are red, and so it comes out foamy red, so it looks like blood, right? What does it cost you? $5, right? But it's about the interaction and the opportunity to book a meeting for one-on-one discussions to talk about you, your company, referrals, relationships going forward at the rest of this year and into the new year. That's how you finish 2021 strong, all right? The next thing I want you to talk about is your caregivers and the covering shifts. Now, number one, hallelujah, praise the Lord, thank you, Jesus. There's no more stimulus money, right? Unemployment is over, right? That's it. It's $300. It's done, right? September 4th was the last day people could qualify for it. People are getting that last bit of money. Something that I want you to know, though, I've been doing a lot of research on this. I've also spoken to other industry experts in our space and other HR labor experts, not just in our space, just in general. Again, I don't care about politics. Honestly, I don't care who is in the White House. I don't care whatever. I'm going to live my life and run my business the way that I want to within the parameters of legal limits, and I'm going to do well because I don't give a damn, right? That's Steve the Hurricane, all right? And that's who I am, and I'm hoping you like that kind of personality and that attitude, all right? But the truth of the matter is, in the last 18 months, every one of us who continued to work, we continued to work, and it is what it is. For the folks who didn't work, though, we created new habits, meaning these are folks who went from working regularly to not working. And so it takes time. I forget the exact quote or who was the one who came up with it, but it takes on average 3 weeks for someone to create a new habit. Think about it if you're dieting, right? What are the hardest weeks of the diet? It's the first 3 weeks of the diet. Once you're a month into it, you're routine, you're consistent, you understand, you know what you got to eat, you know what you got to do, whatever. Fitness programs, right? I work out regularly, right? You know, it takes 3 weeks to get back into it. I took last month off down in Florida on vacation. I'm in my second full week now, and man, I'm dogging it, but I'm starting to hit my stride, getting my muscles back, right? I'm starting to hit my stride again. It takes 3 weeks to create a habit. So for the folks who came back to the workforce, who are going to start applying for jobs in the next month, make sure that you are ready for these new folks coming in, meaning spend more time in orientation than you normally do. Have more planned visits when you start a case. Maybe start a case and come back 2 or 3 times in that first week. And I know it sounds excessive, but you got to remember, this is somebody who hasn't worked in the last 18 months. And what do? We are taking care of somebody, right? This is an elderly patient that needs us. So we're going to have to do some extra coddling. We're going to have to do some extra hand holding for this new wave of people re-entering the workforce. So I'm just calling it like it is. Be prepared for it because I want you to be successful. So on one hand, thank God this is ending because it's going to force more people to come back to work. On the other hand, be ready for the people coming back who haven't worked because it's been 18 months. And they're out of routine and they're out of practice. So be ready for that when you're dealing with your caregivers, all right? I want you to also recruit specifically for needs, all right? And so this kind of goes to what I was saying with your inquiry training and how you're answering the phones and pricing and everything else. And, you know, back in the day at CareChoice, my company, and I'm sharing some specific details with you, but we always had a base rate and it went up from there. And so when somebody would tell me that mom is on hospice, well, hospice is a much more medically complex, difficult client. It's not just somebody who's actively dying. They're actively dying from something, right? So I can't just send a companion into that house. I got to send somebody who's got experience. We used to charge extra couple dollars an hour. I think it was like $15 a day on our live-in rate because we had live-in rates. So it's $15 a day, and I'm pretty sure it was like $2 an hour more per hour for hospice cases because it's more medically complex. If somebody needs transfers, like they can't get in and out of bed, they can't get out of a wheelchair together, I'm going to add $2 an hour to my base rate. I'm going to add $10, $15 a day to my live-in rate because that is a more seasoned, more qualified caregiver required based on the situation presented. And this is all stuff that you have to communicate both on the phone and in person when you're selling your cases. So I would walk into a house and I would see somebody is totally bedbound. They have no family or friends. The person cannot get to where they have to go or anything else. They have 5, 6 different chronic conditions. They're legally blind. They need transfers. They need showers. They need continence care. They need total assistance. That person is going to be charged $5 to $6 an hour. And this is what I did back in 2011, 2010. This is what you have to do. $5 to $6 an hour more than my base rate. And I told the family up front, you know, dad's got a lot of needs. I only have 3 or 4 caregivers that could possibly do this. And they got like 5, 6 years experience. I have to pay them more. This is what the rate is going to be. And it's objective, not subjective, meaning, well, you know, I don't know, whatever. No, it's legit. It's based on your needs objectively. So based on your needs, a la carte, here's your price for this case. Do you want us to do it? Yes, great, boom. Now I have extra revenue to get the best caregiver possible. And let me tell you, folks, when you have people that you've interviewed several months ago, and then you know that they're not working for you, right? But you know they work for somebody, but you know that they have like 3 or 4 years experience, and you know you offer them a case, and say your average pay rate is like $15 an hour. Now you call that person back and you see if they're available and say, hey, listen, Jennifer, Barb, or whatever, I got a case that's a lot of needs. I've already talked to the family. I can give you $19 an hour for this case if you take it. You'd be surprised how many caregivers will say yes to that and then come in and then take that case. And now you got the case staff, you got it covered. You're compensating the caregiver along the lines of what their experience and their pedigree is deserving, right? Because again, remember the experience I'm saying, this is a very difficult case. And you know, you got to send a seasoned person in there, but you're billing accordingly and you're not killing your margins, right? And the business is still profitable, something we will come back to later on in this webinar here. So again, stay ahead of the caregiver crisis by doing these things that I'm talking about here. And then you got your holiday pay. You know, you got to plan for the holidays. Something that we used to do at CareChoice back in the day all the time regularly was we knew the holidays, but we also knew that we were a 24/7 business. And so based on the clients who needed help on the holidays, because a lot of times family comes in and they cover it for you. But for those couple of people who need a caregiver, you tell your caregivers in advance they can only have for sure one of the 3 main holidays, Thanksgiving, Christmas, New Year's, off. You can only have one of those days off guaranteed. Let's plan for it now. If your customer decides to change it later, we can change it later, but this is healthcare, so we want to be ahead, stay ahead of it, right? You let the caregivers know. You obviously give the holiday pay. Try and get caregivers specifically set up to work the holiday to cover for those who are taking off. All the other stuff, again, Plan your work, work your plan. This is how you do this with as minimal challenges as possible. And I mentioned AidQuest here because they have a tremendous program that's worth looking into, which really helps to improve your caregiver turnover ratio. And so I highly recommend, they're going to be at the boot camp next month, or not next month, in November, and you can see them there. But if you want to reach out to them in advance, you have their information. AidQuest, definitely take a look at them. Thank you, Cameron, for sponsoring. Thank you for creating this program, because it really does make a difference in your ability to retain and attract new caregivers. So next thing you want to do with your holidays is also plan for it. I'm not going to spend a lot of time on this because it's pretty self-explanatory. Make a plan with what your standard operating procedures, that's what SOP stands for, standard operating procedures, are for the holiday. Meaning, if I am a referral source, because healthcare is 24/7, if I'm a hospital discharge planner or social worker, if I'm a physical therapist at a skilled nursing facility, if I'm the director of nursing at an assisted living community or whoever, I need to know what your plan is in the event I have somebody who needs help on a holiday. That's what the flyer is promoting, how to reach out to us during the holiday. You obviously want to make 2 different flyers, one for Thanksgiving, one for Christmas and New Year's, that can be combined together. And you go around about a week or 2 before the holiday advertising and promoting your on-call for that. You want to find out who the MOD is. MOD is another acronym if you want to write it down. MOD stands for Manager on Duty. Manager on duty at the referral sources that you're going to, all right? Who is the manager on duty during the holiday? Because there's always a manager on duty, even if it's the holiday, because healthcare is 24/7. Strokes don't care that it's Thanksgiving. Hip fractures don't care that it's Christmas, all right? Those conditions still happen to folks even on the holidays, all right? And so by you having a plan in place, this is a great opportunity, especially for the newer businesses, to get your foot in the door. I always think back, one of the things I love to share with folks as I look at my career, right? I've been doing this now for 16 years. I've been in the home care business 16 years. 16, I'm gonna say, great years. Yeah, there's been challenges and issues along the way. Who doesn't deal with those? But these have been 16 great years of my life. I'm 40 years old. I'll be 41 in November. And the last 16 years since I was 24 have been amazing, all right? And I will tell you, way back in my second year, part of how I was able to outwork my competition was doing exactly what I'm teaching you. So I would have a plan, and then all of a sudden, yeah, on Thanksgiving, I'd get a phone call, somebody needing help. And I would say, how soon do I need to be out there? What is necessary, whatever. And a lot of people say, you can come out tomorrow, or I talk to the family, and they're like, we know it's Thanksgiving, you can come out tomorrow, whatever. But I answered the phone. I received the referral. I was ready for it, got the information, scheduled the appointment for Black Friday, right? So that I could skip shopping and go see prospective clients. Same thing on Christmas Day. Had a couple of phone calls early on in my career. Scheduled the appointments. Nothing was so urgent I had to come out on Christmas Day. But the fact that I answered the call on Christmas Day and then scheduled the appointment for the 26th or the 27th meant that they didn't call another agency to schedule the appointment because they already had an appointment with me. That is huge. That is one of the many ways that I outworked my competition and went from being the, oh, well, Steve saved the day, to Steve is the only company that we work with, right? Because you deliver on everything that you promise you're going to do. And that's how you have explosive growth during the holidays. And then finally, in closing, getting paid. And these are, if you're not accepting veterans benefits, accept them. But set a cap on it. Be careful with the VA. I've seen people get screwed. I had one person who I know had to write off $100,000 in losses, and they decided not to accept the veterans program because in their state, it was either poorly managed or poorly funded, but they weren't getting the money. So just be careful. but I want to make sure that when you accept it, you make sure that you're on top of your numbers, you dot your I's, you cross your T's when it comes to the VA, because it's good to have that benefit, but just make sure that it's not too much of your revenue as well. I think to a lot of my Medicaid clients, a lot of people who are contacting me have different types of businesses. A big portion of my clientele are people who have 100% Medicaid businesses that are trying to add more private pay, because as a agency business owner, you have more control over the revenue coming from your private pay clients than you do your Medicaid. And I personally recommend having no more than 50% of your revenue in Medicaid. And the reason why I say that is because if the government makes regulation changes, but they don't adjust the compensation, and in almost every instance, every person I know, they'll make regulation changes like this, but they don't up the compensation until 2 or 3 years later. If you're 100% Medicaid and they make changes that impact that bottom line, you're in trouble. You have no control over that. That's why a lot of people are adding the private pay and keeping it balanced. When it comes to the VA, I put the VA under not charity, but I like to maximize the VA to no more than 10% of the total revenue coming into my business. So I will continue to take VA clients, but I'm relying on the veterans benefit to pay me. And if they decide not to pay me, I still got to pay those caregivers. I still have to operate my business. So it is to my advantage to limit how much revenue I'm allowing to come in from this one payer source, because if they decide not to pay me, I'm hung out to dry, right? So just remember these numbers that I'm telling you. That's just helping you to set up your business for long-term success going forward. Long-term care insurance, if you're not accepting assignment of benefits and you're not billing long-term care insurance directly, you are missing out on hundreds of thousands, if not millions of dollars every single year. I know several franchises that make a huge effort in this area, where many of their franchisees, 40, 50% of their total annual revenue comes from several different long-term care insurance companies, and they help with the collections and they become preferred providers and all these other things. That's free money, and they give you your hourly private pay rate, not a rate that's set by the government. That's a great one, all right? If you have people that have to go to collections, I hate collections. You usually lose when it comes to collections. So keep your accounts receivables tight. That's what I mean by that. Nobody's allowed to be 30 days out. 30 days out, if somebody's 30 days behind terms, you are going to that house and you are sitting there and you are waiting for a check, a credit card payment, an ACH transfer on the spot, or you are leaving with that caregiver and not coming back into that house. It is not, you're not abandoning anyone. All right, this is not abandoning. This is nothing wrong. Somebody's 30 days out. They literally had a month to make payments with you. You have to run your business. This is a business. All right, unless you are a nonprofit, not private pay situation, and you're just giving caregivers out and you're in that position, then that's charity, all right? But if you are a fee for service, you have to have terms and you have to hold people accountable. I would much rather lose 30 days of compensation and never get that money than to let somebody go 90 days and then go through the whole process of collections and everything else, and then it gets lawyers and it gets ugly, and then you're lucky if you get pennies on the dollar. So whatever your terms are, keep strict to it. It's nothing personal. I love that. This is a business saying, right? We've all heard it. It's not personal, it's business. And I say this, and again, 100+ people in here right now live with me, and hundreds were registered who are going to get the recording later on down the line. It's not personal. It is just business. Set your terms, but enforce and keep those terms strict. And I know most of you understand that, but I know there's probably 10, 15 people who are sitting here like, I know, he's right, we got to make sure we do it, whatever. And then, at the end of fourth quarter, everything that I told you to do, planning for the fourth quarter now, start to plan your 2022 in the end of December. Things do slow down a little bit around the holiday season. It's a great time, that week between Christmas and New Year's. It's a great time to plan 2022 so that you can have a record-setting year. When I look back over my top clients, and these are the members of the Home Care Elite Academy, right? I keep talking about my Home Care Elite Academy. The reason why I keep talking about my clients who are in that Elite Academy is because I spend the most amount of time with them. I visit their offices. I talk to them on the phone regularly. Heck, I texted 4 of them an hour ago, right? So I talk to my clients regularly who are in that Elite Academy, and I know their businesses, and they grow by quantum leaps, literally $1.5 million more than they did the year before in total revenue generated. Their profits are growing through the roof and everything else. The reason why they're having all this is because I help them plan for it, and then I help them to execute the plan along the way. But it doesn't just happen. You have to plan for it. We are literally changing business owners' mindsets to plan for this, which really leads me to the last point and what I've now done for several of my clients in helping them exit their businesses. Whether you just started your business and you got your license this morning and you're officially open for business, or you started in January, or you started 5 years ago, or you started 25 plus years ago, someday in the future, you will be ready to exit your business, meaning you're going to sell it, or you're going to legacy gift it to your children or whatever. You have to run every single year being on top of your financials, making sure that you have enough what's called EBITDA, or enough profits and revenue that's coming to you as the owner, so that one day when I sell this company or whatever I'm going to do, I'm going to get multiple times that EBITDA as the sale of my business. You know, I know people who have a $5 million business and they only have a 200,000 EBITDA. $5 million business, 200,000 EBITDA, that's only worth about 800, 900,000, maybe $1 million. Same person with a $5 million business, but an $900,000 EBITDA, that business is worth $5 million, maybe even $6 million. That's a huge difference. Same revenue every year. But the EBITDA is so different, and then that multiple is very different, and it means your retirement, your exit, whatever you want it to look like, you want it to be done correct. You want it to be done right. You might as well start running your business appropriately now, so that when the day comes and you are ready to exit the business, you can do so, and you don't have to bat an eyelash, and then you can retire and go lay on a beach, start a new career and something else, and do whatever you want to do. So that's the end of this webinar here. And you know, I hope you got a lot out of this, and you heard me say at the very beginning that this is the final boot camp that I'm going to ever do. All right, so I would love to have you at this boot camp, because there will be no more Hurricane Marketing Enterprises marketing boot camps ever again. This is the last one that I'm going to do. All right, so you know, with that in mind, there's only 14 tickets left, just 14 tickets. And so you see the phone number on the screen, you see the website where you can get all the information. And I'm going to say that if any one of you wants to, as my thank you to you, if you want to get one of those last 14 tickets and you call my office and you speak to Dee or you speak to Jody, who are here, they're here right now. If you want to come to that event and get one of those last couple of tickets I have, as my thank you, I'm going to give you for free my Rapid Results Kit. This is $1,000 value right here. You get a whole bunch of training and content. You get the $3 million business blueprint. You get a coaching session with one of my coaches. You get schedules. You get a closing presentation binder to help you to close those custom sales that I was talking about. All this stuff you get for free if you get one of those last 14 tickets, but you got to call. So that you see that number, I want you to write it down, 1-848-444-9865. And if you take one of those last tickets, I'm going to give you a Rapid Results Kit for free as my thank you for coming to my last boot camp. And so now what I'm going to do, folks, you see on the little go-to webinar panel to the top of your screen, there's a little option that says the word questions. So I want you to click questions. All right, and in there where it says questions, what I want you to do is I want you to write down a number 1 through 10, and I want you to just write in there 1 through 10, and whoever is the first person I see that comes up that guesses the number I have written right here that I'm pointing to, what I'm going to do is I'm going to give you a free ticket to come to that boot camp. All right, so let's see. I saw the number come up. So first off, what is the number? The number was 3. So the first person to write down number 3, and I'm going to go check and see who that was because a lot of numbers came in. You're going to get a free ticket to come to the boot camp. And so the first person who guessed the number correctly is Rudy Rabel. Rudy Rabel. So Rudy, you see the phone number. I want you to call my office. All right, and give your information. They'll go over how you can get your free ticket to the boot camp. If you can't make it, we'll give you a recording of the event. So this way, if you can't come, you'll still be able to get the recording of it. But Rudy Rabel, you won the free ticket to come to the boot camp. And everybody else, again, if you want to come, you know, the boot, there's only 14 tickets left. Well, Rudy has one, so there's only 13 tickets left. And if you take one of those last couple tickets, I'm going to give you one of these rapid results as my thank you for coming to the boot camp. And then I'll see you in November. We're going to give you everything you need to scale and grow your business. And for folks who are thinking, you know, I really want to go to that boot camp, or maybe I want to send my marketer, the focus of this boot camp is very owner focused. All right. Now, if you want to bring a marketing rep, bring a marketing rep with you, or bring an executive director with you, because part of what I talk about at this boot camp is caregiver recruitment and retention, how to run your business more efficiently so that so much is not on you as the owner and you have to do all the work yourself, how to better manage and run and divide responsibilities up. I'm also going to do a little bit of presentation and preparation, how to develop an executive director, meaning someone who's going to take a lot of the responsibilities off the owner's plate. Like when I think about my Elite Academy, the biggest thing that I do with my Elite Academy members is helping to free them from the constraints of their business. And of course, we're going to talk about sales and marketing. So really, there's a 4-part focus of this boot camp, and it's 100% how to scale your home care business. And that's what we're going to be doing at this boot camp. So I hope to see you there. You know, I'll be there, my staff will be there, my team will be there, all of our sponsors will be there. There's only 13, 14 tickets left, folks. Make sure you get one of those, because when the event is sold out, that's it. You won't be able to come. And you know, this is my last boot camp. So I want to thank you all for 9 years of boot camps. It's amazing what the future holds, and I have some huge announcements and stuff coming later on in the year. But for now, this will be the last boot camp, and I hope to see you there. Thank you again for your time. You know, the phones are ringing. I see all of our lines are active. So if you call and you can't get through, just keep calling. You know, take those last couple tickets. But again, thank you for your time. It's always a pleasure. You know, and again, be grateful for everything that you have, because you know, life is short. You know, one of my friend's fathers died 2 or 3 weeks ago, got COVID and died from it. And you know, I co-authored a book called One Habit for Entrepreneurial Success. And this past weekend, the main project leader, Steven Samblis, who's another friend of mine, he died on Saturday from COVID. So, you know, please be careful. Please be, protect yourselves. And then also, though, be grateful for the time that you do have. Be grateful for the moments that you have, because life really is precious. But again, I thank you so much from the bottom of my heart for you being here all the way through to the end. I love you all. I pray for you all. God bless. And let's make 2021, let's finish this year strong as we move forward to 2022. Signing off for now. Take care, my friends.